Huduma Poa Health Network is a social franchise run by Kisumu Medical and Education Trust (KEMET) through the support of USAID in partnership with PS Kenya. The franchise was officially launched on January 30, 2013. The network is currently made up of 80 privately owned health facilities serving urban and rural underserved population, with 63% rural and 37% urban. Huduma Poa operates in 15 counties drawn from Nyanza, Western and adjacent to Rift Valley regions. The network aims at harnessing skills and energies of private health providers to integrate health services and ensure facilities are a one-stop shop for the target underserved communities. To realize this, the franchise builds capacity of healthcare providers through workshops, quality assurance, assessments, support, supervision, and on-job training based on Ministry of Health standard operating procedures. The trainings focus on family planning method mix, HIV counseling, testing, care and treatment, prevention of mother-to-child transmission of HIV/AIDS, cervical cancer screening, and integrated management of childhood illness. The franchise has a team of quality assurance officers who offer technical support to network providers aimed at enhancing quality service provision in the health areas supported by Huduma Poa.
My name is Maya. I work as a quality assurance officer in the Huduma Poa program, majorly based in Western region and North Rift. My main responsibility in the program is to ensure quality standards are met in the franchise facility. Two is also to ensure that the providers have been capacity built through training, technical assistance, and through on-job training.
I'm Marcia Nago. I work for KEMET in the HIV program as a quality assurance officer. Some of my duties include liaising the facilities in my region with the community so that they can easily access communities. And again, they can easily access the reporting tools and make sure that they report in time so that they can get their activities.
The franchise has an established demand creation component comprising of 160 community health workers and 5 demand creation officers mandated to forge linkages between the facilities and target communities to promote demand for and access to the health services in line with Ministry of Health's community strategy.
Wakati tunawafunza hivi tukiwapatia ishara, si tunavaa kwa kidole. Unapata mzee atavaa kwa kidole lakini kule ataenda tu kawaida. Si ndio? Mpira ni mbinu ya kupanga uzazi ambayo inavaliwa katika vifaa vyetu vya kujamiiana. Sawa sawa? Kuna ya wanaume na kuna ya wanawake. Sawa sawa? Kuna njia gani nyingine tena? Sindano. Ile inadungwa hapa kwa shingo.
Hapana.
Sindano inadungwa wapi?
Mama unadungwa.
In the past 2 years, the network has strived to forge and sustain linkages between the private providers and the Ministry of Health.
For me, I was sent by the Executive Director, Kisumu Medical and Education Trust, at least to be able to give a message of goodwill and continue to say that us in the private sector will continue to support the public sector and whatever we do. And that is why, as we try to forge good linkages between the private sector and the public sector, let's ensure that we're able to share the resources that we have. And that we have already begun from the other counties where we are working.
This has shown remarkable improvement in submission of monthly service delivery reports to the Ministry of Health, commodity forecasting and quantification, ordering and acquisition of reproductive and child health commodities by member clinics from the Ministry of Health stores.
We really work with the Ministry of Health to link every facility to the source where they can get commodities. Some have really succeeded to the extent that they are now being supplied directly by KEPSA.
Within a period of 2 years, Huduma Poa has reached over 150,000 women of reproductive age with integrated reproductive health services and information through Huduma Poa service delivery points, Huduma Poa days, and community health promotion sessions and outreaches. 26,614 women have accessed family planning services, whereas 34,221 clients have been reached with HIV testing and counseling services. The franchise utilizes different strategies to reach out to the underserved communities with integrated reproductive and child health services.
Iwapo mtoto wake alikuwa anaenda kabla mai leo chanjo, tafadhali aje tu hapa na ataweza kupata chanjo hiyo. Huduma Poa na KMET pamoja na madaktari wetu wa kabla mai wanatoa bila malipo. Tafadhali, iwapo sauti hii inakufikia, ninakuuliza uweze kufika hapa katika.
Community health volunteers play a critical role in demand creation and health promotion activities. In an attempt to reach more clients, the Huduma Poa community health volunteers mobilize through the church, chief barazas, market sites, women groups, and conduct targeted household visits.
Machalo kusalaba mane misoyo tisoyo dhofuko mar nyodo ene gima ene eyo ma onge gi kwiri moro amora mobiro kele ang'o obiro kele dendi mak mana ni samo donje dendi.
To ensure that clients get adequate balanced reproductive and child health information, Huduma Poa build the capacity and proficiency of community health volunteers through trainings on the wider concept of community health strategy in line with Kenya Essential Package for Health. The training focuses on varied areas including basic information on modern family planning methods, cervical cancer, HIV testing and counseling, community mobilization, pillars of primary health care, and community-based health information system. Majority of the network providers have confirmed that since they joined the network, their workload and patient flow has increased with consequent improved profitability.
I entered into private practice way back in 1995. I started family planning, but I reached a stage where I had to stop because of the clientele. 2 clients in a month. And you can imagine you have taken the commodities from the government. So I found it a bit difficult to continue with the family planning because the clients were not there. Right now, the partnering with the KMET and the mobilization that we started, it has actually made the numbers go up. Okay. Because I can now report more than 10 per month, which is, to me, it's an improvement.
The IUCD uptake is higher. The implants, Janel and Blenon, and all other methods. We've been equipped with enough knowledge also to give HIV testing and counseling strategies, which previously we used to have low numbers, but now actually, like me, if I was to do to every client, my numbers could be very, very high, I can tell you. Let me tell you the truth.
Sasa HIV watu wanakuja kwa winda just like that. They just read and come. But before that, in fact,
So the service chat has been very useful to you?
Very useful.
Okay.
hata branding mtu anakuja what is happening unawaambia we are offering all the services ni Huduma Poa and then hata toka bure si atanunua panado ni kitu I'm happy.
I can also not forget to thank KMET for the support they have given us also through the CHWs that I think they are the ones who are paying. So it has been a big deal. In fact, the CHWs have been doing us a very good job, especially on mobilization. And right now we have very many referrals that have been done through the CHWs. I cannot forget to congratulate them for that.
In the coming years, the network intends to introduce voucher schemes that supports family planning and encourages safe delivery with skilled attendants in these areas. The voucher system will ensure there is increased access and demand for Huduma Poa supported services, allowing providers to be reimbursed service fees for the services offered.
Ye bana mokilio tozali ba fiere zali compliqué. Ye bana mokilio tozali ba fiere zali danger. Mingi bako kikolinga yo sempo na entere. Mingi bako kikolinga yo sempo zali na mbongo. Basusu bako kikolinga yo sempo na bolingo ya very